Welcome to the Sunshine Training Center. For tips, how-tos and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. In this short video, we'll demonstrate how to use crepe elastic bandages for passive stretching, more specifically to achieve combined fist and wrist flexion. This demonstration was prepared by Qingyuan Lin, Senior Occupational Therapist at the Taipei Rehabilitation Center of Sunshine Foundation. This video is a continuation of a previous blog post and video in which we talked about the principle behind the use of crepe elastic bandage for passive stretching, how it can be used to achieve combined stretch of multiple finger joints, as well as relevant precautions. You can check out this previous blog post on Sunshine Training website, as well as watch the previous demonstration video on our YouTube channel. As a reminder, be sure to use elastic bandage with good elasticity. Bandages that lost their elasticity won't be able to provide sufficient tension to achieve the desired stretching effect and instead will end up restricting blood circulation like a tourniquet. Avoid using elastic gauze bandage that will also restrict blood circulation. Because this stretching method involves combined finger flexion by making a fist, caution is advised if wounds are present on the fingers, or there are other issues for which passive stretching is contraindicated. Also, when using elastic bandage to make a fist and wrist flexion, the pain felt by the patient will be greater because more joints and more skin are simultaneously recruited. So, the idea is not to achieve full range through stretching, but instead to produce a stretching effect over scars to promote moderate wrist flexion that is within a tolerable pain threshold. In addition, it is necessary to avoid creating excessive pressure over the median nerve of the wrist. When is the right time to start strengthening wrist flexion? It is usually recommended that MP flexion be 45 degrees or even above 60 degrees before starting to strengthen wrist flexion. If MP flexion is less than 45 degrees, enhancing wrist flexion will only promote MP extension due to the tenodesis effect, which is detrimental to promoting MP flexion. Remember, appropriate evaluation of the patient's condition is essential to determine the suitability of using elastic bandages for effective and safe hand rehabilitation. Now let's demonstrate how to bandage the hand. Use a triangular wedge upon which the hand and forearm can be strapped. Place the wrist over the edge of the wedge, so that the hand can drop and perform wrist flexion unimpeded. After the forearm is secured to the wedge with the two straps, gently wrap the elastic bandage around the forearm twice. At this time, the elastic bandage does not need to be overstretched or generate excessive pressure. Wrap the elastic bandage from the radial side to the palm, pulling the wrist in flexion. The bandage exerts tension on the back of the hand. Continue wrapping it in circles to achieve a flexion range that the patient can tolerate. After confirming that the right flexion range is achieved, secure the end of the bandage in place. When using a wedge, make sure to avoid the mistake of placing the wrist too far from the edge because wrist flexion will be limited by the wedge. Although wrapping the hand in a fist with elastic bandage will temporarily affect blood circulation and the patient may feel tingling in the hand, it is basically safe. It is recommended to leave the hand bandaged for 15 minutes per session, but each session should not exceed 20 minutes. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation related tips and videos, and visit our website for news about our latest training programs.